Prostate cancer is the second most common cancer worldwide, and understanding its risk factors is crucial for prevention. While genetic and lifestyle factors are well studied, an unexpected player has emerged from recent research. Your mouth. That's right, emerging evidence suggests a link between oral health and prostate cancer. But how strong is this link? What does it mean for your overall health? And what can you do to take control of your prostate health? Let's dive into this fascinating topic. Before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button or hit subscribe. Thank you, and let's begin. In 2025, several studies published findings that revealed a new twist in the story of prostate cancer risk. Factors: chronic periodontitis, a common gum disease, appears to play a role. But wait, let's rewind. What exactly is periodontitis? Periodontitis is a severe form of gum disease. It's more than just a quick trip to the dentist for a cleaning. It involves the gums pulling away from teeth, causing pockets that can become infected. This can lead to tooth loss if left untreated. So what's the link between this oral health issue and prostate cancer? One large nationwide cohort study conducted in Taiwan analyzed data from over 680,000 individuals. Researchers were examining various health conditions and wanted to understand the role of periodontitis in prostate cancer. They discovered that men diagnosed with periodontitis had a significantly higher risk of developing prostate cancer. The risk was about 22% higher in men with periodontitis compared to those without. Interestingly, the study also looked at men who received periodontal therapy. These men showed a much lower risk of overall cancer, specifically a 59% lower risk of cancer. This finding suggests that treating gum disease might actually play a role in cancer prevention, but Taiwan's study wasn't an isolated case. Another study published in the Journal of the American Dental Association in 2023 found similar results. Researchers analyzed data from the health professionals' follow-up study. Their findings suggested that participants with a history of periodontitis were 49% more likely to develop prostate cancer than those without periodontitis. Now here's where things get really interesting. Both these studies found a modest but consistent association between chronic periodontitis and prostate cancer risk. However, it's important to remember that association doesn't always mean causation. Could there be other factors contributing to this relationship? Before we delve deeper, it's crucial to grasp the biological mechanisms that might be connecting oral health and prostate cancer. One leading theory points to chronic inflammation as a key player. Periodontitis is characterized by persistent inflammation in the gums. This inflammation can spread systemically, affecting other parts of the body, including the prostate. Elevated levels of inflammatory markers like C-reactive protein have been observed in both periodontitis patients and prostate cancer patients. Certain bacteria found in the oral cavity, particularly Porphyromonas gingivalis and Tannerella forsythia, have been detected in prostate cancer tissues. This suggests that these oral bacteria could play a role in tumor development. Additionally, studies have shown that periodontal pathogens can reach distant sites like the prostate via the bloodstream or lymphatic system. Once there, they can trigger an immune response leading to chronic inflammation. This prolonged inflammation creates a microenvironment that could promote cancer growth. Another intriguing area of research focuses on epigenetic modifications. Studies suggest that oral pathogens might influence gene expression in prostate cells. For instance, exposure to P. gingivalis lipopolysaccharide has been shown to alter gene expression profiles in prostate cells, potentially contributing to carcinogenic changes. Moreover, the oral genitourinary axis is a relatively new concept that proposes functional connections between the oral cavity and genitourinary tract. Alterations in oral microbiota composition have been linked to urinary tract conditions like overactive bladder and prostatitis, and while research is still exploring this connection, it's possible that disturbances in the oral microbiota could indirectly affect prostate health. While research progresses, it's essential to consider the clinical implications of these findings. The link between periodontitis and prostate cancer risk adds another layer to preventive health care. For men, particularly those with moderate to severe periodontitis, regular monitoring for prostate cancer might be beneficial. This could include monitoring prostate-specific antigen levels and routine urologic exams. Additionally, managing periodontal disease effectively could be a valuable tool in reducing prostate cancer risk. Periodontal therapy, which aims to control inflammation and eliminate harmful bacteria in the mouth, may not only benefit oral health, but also potentially reduce systemic inflammation and consequently lower the risk of diseases like prostate cancer. Interestingly, one Korean cohort study found that men with recurrent periodontitis were at a higher risk of developing benign prostatic hyperplasia (BPH). This suggests a potential link between oral health and prostate enlargement, possibly due to shared risk factors or underlying inflammatory processes. The study also identified specific bacteria, including Escherichia coli and Rheumatococcus, which were more prevalent in individuals with both BPH and periodontitis. These findings support the concept of an oral genitourinary axis and highlight the potential role of oral dysbiosis in prostate pathology. It's important to note that while these findings are promising, they don't paint a complete picture. More research, particularly prospective cohort studies that control for confounding factors such as smoking, diet, and other lifestyle habits, are needed to establish a definitive cause and effect relationship between periodontitis and prostate cancer. Such studies will help refine our understanding of the temporal relationship between oral health and cancer development, providing clearer insights into whether treating periodontal disease truly reduces prostate cancer risk. Furthermore, molecular studies are crucial to unraveling the intricate mechanisms linking periodontal disease and prostate cancer, investigating pathways of microbial translocation, elucidating inflammatory signaling networks, and examining genetic susceptibility will provide a deeper understanding of the biological processes involved. Identifying specific bacterial species and their virulence factors that contribute to prostate carcinogenesis will be critical. Moreover, exploring epigenetic modifications and the dysregulation of host defense mechanisms will shed light on how oral pathogens influence gene expression and immune responses in prostate cells. As research advances, the potential for developing novel diagnostic and therapeutic strategies emerges. Discovering salivary or serum microbial and inflammatory signatures could offer valuable tools for early detection and risk stratification within prostate cancer screening programs. Targeting periodontal pathogens or their products as therapeutic interventions or developing microbiome-based therapies hold promise for not only treating oral diseases but also potentially mitigating the risk of systemic conditions like prostate cancer. In conclusion, the emerging evidence linking oral health and prostate cancer risk highlights the interconnectedness of our bodily systems and underscores the importance of a holistic approach to healthcare. While the exact mechanisms remain to be fully elucidated, the consistent findings across various studies warrant attention. The concept of the oral genitourinary axis adds a new dimension to our understanding of prostate pathology, suggesting that disturbances in the oral microbiota can indirectly affect prostate health. Incorporating oral health screenings into routine checkups for men, particularly those at risk of prostate cancer, could be a cost-effective preventive measure. By addressing periodontal issues and maintaining good oral hygiene, individuals may not only protect their oral health but also potentially reduce their risk of developing prostate cancer. As research continues to delve deeper into this fascinating area, we can anticipate more refined and targeted preventive strategies that consider the intricate interplay between the oral cavity and overall health. Thank you for watching. We hope you found this video informative. If you have any questions, feel free to comment down below. We'd love to hear from you. Please don't forget to hit the like button and subscribe so you never miss out on future videos. Have a healthy day.